Hello dears, let me tell you about one of the most important stabilizing factors of the shoulder joint today, that is rotator cuff. It is a musculotendinous cuff seen around the shoulder joint, increasing its stability. So that is the lateral view of the scapula. You can see the shallow glenoid cavity here. This is the acromion and this is the coracoid process. You see, the humeral head articulates with the glenoid cavity. Since the humeral head is larger compared to the glenoid cavity and also the glenoid cavity is shallow, the shoulder joint is one of the most unstable joints in our body. There are numerous factors which increase the stability of the joint. One of them is coracoacromial ligament. It stretches from the coracoid process to the acromion, and together with its bony insertions, bony attachments, it forms an arch above the shoulder joint known as coracoacromial arch. There is a bursa beneath the coracoacromial arch. So the coracoacromial arch and the bursa beneath it will form a larger socket for the humeral head to articulate, or secondary socket of the shoulder joint. This increases the stability of the joint. Let us see the rotator cuff. I have already said that it is formed by muscles which get attached to the upper end of the humerus around the shoulder joint. First one is the supraspinatus muscle. The supraspinatus muscle comes beneath the beneath the coracoacromial arch to reach the greater tubercle. It spreads out and get attached to the upper part of the greater trochanter. The next is the infraspinatus and teres minor muscles, which get inserted to the lateral aspect of the greater tubercle and forms the rotator cuff posteriorly. Anteriorly, it is represented by the subscapularis muscle, which get inserted to the lesser tubercle. You can see that tendons of all these muscles fans out and unite with each other. It also unites with the capsule of the shoulder joint, thus strengthening it. Even though the supraspinatus is not a rotator of the shoulder joint, infraspinatus and teres minor are lateral rotators and subscapularis is a medial rotator. Since it is formed mainly by the rotator muscles of the shoulder joint, this musculotendinous cuff formed around the shoulder joint is known as rotator cuff. So tonic contraction of these muscles will keep the humeral head in position, that is within the glenoid cavity. So it forms a dynamic stabilizing factor for the shoulder joint. That is the importance of rotator cuff. Now let us see its clinical applications. We see rotator cuff is present only anteriorly, superiorly and inferiorly. It is deficient in anteriorly, superiorly and posteriorly. It is deficient inferiorly. So what will happen? The capsule of the shoulder joint is weakest in its inferior aspect and the humerus can slip downwards during dislocation. Which nerve is here? Axillary nerve. So dislocation of humerus can injure the axillary nerve. In this context, you should be familiar with the fact that even though the humerus slips downwards during dislocation, it will be pulled anteriorly by the strong pectoralis major muscle, and the final position of the humeral head will be below the coracoid process anterior to the glenoid cavity. So the dislocation is classified as anterior dislocation. So the commonest dislocation of the shoulder joint is anterior dislocation, even though the weakest part of the capsule is its inferior part. Clear? So that is one of the clinical importances of the rotator cuff. Next, let us see the individual tendons. You see the supraspinatus tendon, it comes beneath the coracoacromial arch. So whenever it contracts, there is a chance for friction with the bony arch, and this can cause chronic inflammation. Okay, so to prevent this, there is a bursa there, which is known as subacromial bursa, which is one of the largest bursa in our body. Even with the bursa, the friction is there and it can lead to inflammation, especially in older age. Chronic inflammation will cause thickening of the tendon and calcification. The calcified tendon may rupture also. Okay, so the inflammation of the tendon is known as supraspinatus tendinitis, which is common in old age, and rupture of the tendon can also occur after calcification. So, how will the patient present? As the supraspinatus is an abductor muscle, there will be pain during abduction. But that pain is very characteristic. You see, when the supraspinatus contracts, it will pull the greater tubercle medially and the tendon will move medially. So, when the abduction reaches about 60 degrees, this tendon will impinge against the coracoacromial arch. On further abduction, what happens? The tendon will slip through the coracoacromial arch medially so that the pain disappears. So, when the person begins to abduct up to 60 degree, there will not be any pain. Then 60 to 120 degree, there will be severe pain. And after 120 degree, there will not be any pain. That is known as painful arc syndrome, because pain is present only along an arc extending from 60 to 120 degrees. So it is a characteristic feature of supraspinatus tendinitis, and also this can be seen in subacromial bursitis. Okay. So to differentiate subacromial bursitis, there is a sign known as Daban sign. Okay. Subacromial bursa is present just beneath the acromion, and if you press over the shoulder just below the acromion, there will be pain in subacromial bursitis. But this pain will disappear as the arm is abducted, because like the tendon, the bursa will also slip through the coracoacromial arch. So that is known as Daban sign, that is disappearance of the tenderness during abduction. It's the Daban sign. Now, let us see another condition where the supraspinatus tendon has ruptured. The person is unable to abduct the arm because it should be initiated, and the abduction should be done up to 15 degrees so that the deltoid can act. So, in such a condition, the person will show a movement called as trick movement. What he does is, he will tilt his body towards the affected side so that the gravity will aid in movement of the arm away from the trunk. So thus the shoulder joint is now abducted to 15 degree and deltoid can act. So that movement is known as trick movement. It is seen in supraspinatus tendon rupture. Okay. So now we have seen one reason for the supraspinatus tendinitis, that is the friction. There is another point which makes the tendon more prone for inflammation, that is the poor blood supply of the tendon. Okay, it also lead to inflammation. Now let us see the subscapularis tendon. It is the next muscle. The tears of subscapularis is also common. But since the subscapularis is placed deep in the shoulder joint and is very difficult to examine, the tears of subscapularis often goes undetected. So the subscapularis is known as forgotten muscle of the rotator cuff. Okay, so if the pain persists and you are not able to find out any tears in the superior and posterior part of the rotator cuff, always go for a radiological examination to find out tears in the or injury in the subscapularis muscle. So that's the take-home message today. That's about the subscapularis. Now, if the tendons of all these muscles are inflamed, the even slight movement at the shoulder joint will become very painful, and such a condition is known as frozen shoulder, when the person will not move the shoulder at all. Okay. So now we have seen the formation of the rotator cuff and its applied aspects. You may have seen that it is very important functionally as well as clinically. Okay.